My name is Kyle Tormoehlen. I'm a principal with SullivanCotter in our physician and APP workforce practice. My practice focuses on business valuations, assisting healthcare systems with their mergers and acquisition strategies. Today's market has created a new challenge for health systems to overcome in successfully competing in practice acquisitions. Private equity has dramatically expanded its footprint in the U.S. healthcare sector over the past decade. The framework of a private equity transaction is much different from that of a health system. Private equity will purchase the practice at a valuation that assumes a reduction in physician compensation post-transaction, often referred to as the scrape. Since physician compensation is reduced post-transaction, private equity can make a purchase offer based on the increased pro forma profitability generated by the scrape. On the other hand, health system buyers typically have a mature physician compensation plan that establishes how providers will be paid post-acquisition. Oftentimes, the post-acquisition compensation opportunity exceeds historical independent physician compensation in a health system acquisition and further reduces the expected future cash flow or return of the business. This difference in strategy related to post-acquisition provider compensation is the main reason why enterprise price value is typically lower for a health system buyer. So, how do health systems successfully compete with private equity firms for practice acquisitions? Annuitizing value. Health systems have the advantage over PE in post-acquisition physician compensation. While the purchase price is a one-time event, physician owners annuitize their practice's value through their compensation opportunity as part of a larger health system. This is particularly a strong selling point for practices that have an ownership group with a longer expected time until retirement. Focus on your strengths. Systems deliver high-quality healthcare to patients. Their experience, systems, and infrastructure far outpace the capabilities of a PE operator. Emphasizing the health system's strengths in IT infrastructure, consolidated administration and billing functions, access to capital for future practice investment, support services such as marketing and legal, and network benefits such as healthcare coordination, telehealth, and quality monitoring provide a distinct advantage over private equity. Fair market value is more than tables, chairs, and otoscopes. At SullivanCotter, we partner with our clients to identify and value other practice intangible assets that can be considered when determining practice value. Examples include trained workforce in place, also known as assembled workforce, is the collection of skilled and organized employees within a practice. It represents the human capital that contributes to the practice's success. Practice cost avoidance. When purchasing a practice, the acquiring entity enjoys a built-out office location, trained workforce, functioning systems, and an existing patient panel. The acquiring entity may elect to make certain improvements, such as facility or EMR, but there is no ramp-up period whereby the operations are less efficient and marketing expenses must be incurred to attract patients. As a result, the acquired enterprise will require less investment as compared to the development of a de novo practice due to the substantial fixed cost to operate, regardless of the revenues generated. Brand. Brand can be one of the most important assets to a business. This is especially relevant in healthcare, where a strong brand name can help differentiate an organization and signal high-quality care to patients. A strong brand can benefit a health system through attracting patients, attracting top talent, commercial payer negotiations, and enhancing community presence. In partnership with SullivanCotter, our health system clients have been successful in competing with private equity firms for practice acquisitions by including practice intangible assets when appropriate, reframing the value proposition through annuitization, and focusing on their core health system strengths. We would love to help you improve your competitive position in practice acquisitions. Please give us a call.